So, hi, my name is Daniel Murphy. I'm a GP down in Honiton in Devon, a rural market town, and I also work as an associate specialist rheumatologist at the Royal Devon Next Hospital. I'm a NAS medical advisor. So NAS have asked me to record a video today as part of a campaign to try and improve the early diagnosis of axial spondyloarthritis. Now, why is this important? Well, we know that SpA, as we call it, has a huge delay to diagnosis. So depending where you are in the world, it's somewhere between 6 to 8 years between developing your symptoms and getting diagnosis. That's 6 to 8 years of intrusive symptoms, 6 to 8 years of reduced function, and 6 to 8 years where we know if we can get people onto treatment early, they do better. The earlier we can get people diagnosed, the earlier we can get people onto treatment, the better they do both in the short and the long term. So this is really important, but it's not easy. So this is why we're here today. This is what we're going to think about, how we can try and pick those symptoms up early. Back pain is something that's common. It's something that we see millions of times over in the NHS over the course of a year. And it's something that GPs were really good at. We're really good at assessing back pain quickly. The problem is that SpA is an important but a rare cause of a very common problem. So how can we tease apart the vast majority of mechanical back pain and pick out those patients with inflammatory pain that we should get seen by a rheumatologist quickly? Well, the first thing to do is to listen to our intuition. As I said, as GPs, we are brilliant at assessing complex problems quickly, boiling down that presentation to the really important symptoms, and then making a quick management plan. The first thing to do is to listen to your intuition. Is there an alarm bell that's ringing and say, hang on, this pain doesn't seem quite right. This doesn't feel like mechanical back pain. And if that's the case, be curious, ask more questions. Think whether SpA could be the cause here. Once we've done that, once we've been curious, once we've listened to our intuition, there are some hallmark features of inflammatory pain that we can try and pick out that can really help us differentiate between inflammatory and mechanical pain. And I'm going to ask you to think about 5 specific things today. The first is age. So SpA is a disease of young people. It starts early on in life. So whilst the diagnosis can be delayed and can be picked up later, symptoms almost always start before the age of 40. So when did their pain start? Or was it before the age of 40? Is our number 1. Number 2, what was the onset? Inflammatory pain tends to be subacute, gradual onset pain. There's not one index event where you're standing, where you're lifting, where you're twisting, your back goes pain and you get sudden onset pain. So was their pain gradual in onset? The third and fourth relate to exercise. So does their pain get better with exercise, which is the hallmark feature of inflammatory pain? And does it tend to get worse or not improve with rest? So if that's the case, that makes inflammatory pain more likely. Mechanical pain tends to be exactly the opposite. Mechanical pain tends to worsen the more you use your back and tends to ease with rest. The last one is symptoms at night, nocturnal pain. So do they get symptoms at night? The important part of this is not a binary question. If you ask anybody with mechanical back pain, do you get back pain at night? They'll all say yes. But that pain tends to be when you're getting into bed, trying to find a comfortable position. Once you do that, the pain settles and you can sleep. It might wake you up if you move in the night, but you can get back to sleep quickly. So inflammatory pain tends to be the opposite. It tends to not be so bad when you get into bed. As you rest, as you lie flat, that pain tends to get worse and the stiffness tends to get worse and it tends to wake you up in the second half of the night. And importantly, you have to get up and move around to make it better. So do they have back pain in the second half of the night, but they have to get up and move around to ease? So by thinking about those really important 5 symptoms, age, gradual onset, pain that eases with exercise or worsens or doesn't get better with rest, and that nocturnal pain in the second half of the night that people have to move around to make better, we can start to pick up axial spondyloarthritis early. There's some other little things as well. Don't forget some of those diseases that are associated with SpA. either in the patient or the family, of psoriasis, of uveitis, of inflammatory bowel disease, which can all give us clues towards this being pain of an inflammatory cause. And if you think this is inflammatory pain, if you think, hang on, I'm not happy with this, I've used my 5 questions, I think this might be inflammatory pain, the right thing to do is to refer. There aren't any investigations in primary care that we can request that will help us differentiate this further. So to summarise, SpA is often a huge delay to diagnosis. We can help this in primary care. It's difficult, but with some really simple questions, we can help differentiate this condition from mechanical back pain, help get patients onto the right treatment early, and really help improve outcome.